Do you ever feel like you're walking on a pebble, even though there's nothing in your shoe? Or maybe you've noticed burning, tingling, or numbness between your toes when you walk? If this sounds familiar, you might have something called Morton's neuroma. In today's video, I will explain what Morton's neuroma is, how common it is, what causes it, and the symptoms you should look out for, how we diagnose it, and most importantly, how we treat it. So let's talk about Morton's neuroma today. What is Morton's neuroma? Morton's neuroma is a painful condition that affects one of the nerves in your foot, usually between the third and the fourth toes. It's not a true tumor, despite the word neuroma. Instead, it's a thickening of the tissue around a nerve that runs between the metatarsal bones in your forefoot. This thickened tissue compresses the nerve and causes irritation, leading to a neuropathic pain and discomfort. How common is it? Well, Morton's neuroma is more common than you might think. We don't know exactly how frequent they are because not everyone has symptoms. Women are up to 8 to 10 times more likely to develop it than men. And this is largely due to the footwear choices, like high heels or narrow shoes that squeeze the toes together. It usually shows up in adults between the ages of 30 and 60. What causes it? The exact cause isn't always clear, but there are several factors that increase your risk. Footwear, tight shoes, high heels, or shoes with a narrow toe box can compress the toes and irritate the nerve. Foot structures. People with flat feet, high arches, or bunions are more prone to neuromas. Repetitive stress. Activities like running, dancing, or sports that involve pressure on the forefoot can lead to microtrauma of the nerve. Previous injuries, like trauma or prior foot conditions, may alter how the weight is distributed and increase the stress on the nerve. Well, if you like this video so far, don't forget to subscribe to this channel and turn the notifications on so you can be notified when I post new videos here. Which symptoms to look out for? Morton's neuroma often starts gradually and the symptoms can be subtle at first, but over time, they tend to get worse. Here is what most people describe: a sharp, burning pain in the ball of the foot, tingling or numbness between the toes, often the third and fourth, the feeling of walking on a marble or pebble, pain that worsens when wearing shoes or standing for long periods, and relief when removing shoes or massaging the foot. One key feature is that the pain often improves when you take off your shoes and rub the area, a classic sign. How is it diagnosed? Diagnosis usually starts with a physical exam. I'll ask about your symptoms, footwear, and activities. And during the exam, I might press on the area between your toes to reproduce the pain, perform a Mulder's click test, which involves squeezing the sides of your foot while pressing the top. It can create a clicking sensation if a neuroma is present. I would check for other causes like arthritis or stress fractures. Sometimes we'll order imaging to rule out other conditions. Ultrasound can often detect the thickened nerve. MRI is more detailed, but usually reserved for unclear cases. X-rays are typically done just to rule out any bone problem, but they won't show the neuroma itself. How is it treated? Now, let's talk about what really matters: treatment. The good news: most cases of Morton's neuroma can be treated without surgery. Number 1, footwear changes. Switch to shoes with a wide toe box and cushioned soles. Avoid high heels and tight shoes. 2. Orthotics. Custom or over-the-counter metatarsal pads can relieve pressure on the nerve. Orthotics help correct biomechanics and distribute weight more evenly. 3. Medications. Over-the-counter anti-inflammatory medications like ibuprofen can help with pain and swelling. 4. A corticosteroid injection. In some cases, we inject steroids directly into the area to reduce inflammation. This can provide significant relief, though the effects may be temporary. 5. Activity modification. Avoiding activities that put repetitive pressure on the forefoot, like running or jumping. Cross-training. Using swimming or biking can help keep you active without aggravating the nerve. When is surgery needed? If conservative treatments don't help after 6 to 12 months, surgery may be recommended. There are 2 main types. 1. A nerve decompression, which means freeing the nerve by cutting nearby ligaments. And 2. A neurectomy, removing the thickened portion of the nerve entirely. Surgery is generally successful, but like any procedure, it carries risks, such as numbness in the affected toes. So, Morton's neuroma might be small, but it can really disrupt your life if left untreated. The key takeaway? Don't ignore foot pain. The sooner you identify the problem, the easier it is to treat. With proper footwear, orthotics, and medical guidance, most people get relief without needing surgery. And if you know someone who needs to see this video, send this video to them right now. And please remember, this video is not intended to provide you medical advice. It's for educational purposes only. If there is an emergency while you're watching this video, please turn off, go to the nearest emergency department, or call an ambulance. Thanks for watching!